Hey, this is Dr. J from the Center for Total Back Care. Today I'm going to show you how to make a homemade ice pack using really inexpensive ingredients. All you need is just a bag of ice and two white kitchen garbage sacks. So what you do is you just take a bunch of ice, and you want to get quite a bit in here. So you want it, depending too, if you're going to do your neck or your back or some other area, and then tie it in a knot. And you don't want it really tight because you want to be able to flatten the ice out. And then I double it so you can just avoid it from leaking right too soon. And then you can use this for about a day, and then it'll start to leak, but just make a new one. So you want to do on your neck or your upper back, you want to do 20 minutes every 2 hours, 12 to 12:20, 2 to 2:20, 4 to 4:20, etc. Once you're done with that 20 minutes, you put it back in the freezer. By the time you're ready to ice again, it'll be frozen. You just kind of break it up on the countertop, and then you're able to ice again. So in your low back, you want to do 30 minutes every 2 hours. So 12 to 12:30, 2 to 2:30, 4 to 4:30, etc. If you miss and you're off just a little bit, just get back on the hour. So that's just easier to keep track of. Make sure you don't fall asleep with the ice. Now, after about a minute, let's say you're icing your neck, you'll start feeling kind of a burn in your neck. Just take it off for 5 seconds, put it back on. Starts burning again, take it off for 5 seconds, put it back on. Usually 2 or 3 times you're able to get through that. That's the tissue on the verge of becoming numb. Ice is a really deep therapy, but you got to leave it on. You got to put it directly in the skin unless you have vascular issues that would preclude that. But generally, people can put it directly on the skin. You definitely don't want to do chemical packs, those hard chemical packs, because those can get colder than freezing and cause frostbite to the skin. Ice melts, it never gets above freezing, so it won't cause frostbite to the skin. And then the gel packs don't stay cold long enough. But ice is really good therapy, but you've got to leave it on. It goes extremely deep. If you're in a lot of pain, obviously right after an injury, you want to use this for probably the first 48 hours. Obviously, you don't have to use it at night once you're asleep, but during your waking hours. Also, if you're in a lot of pain, ice is extremely effective for that. Make sure that you follow those directions and replay this video if you need to. If you're real consistent with the ice when you're in pain, it'll make a huge difference in how you feel. So give it a try. Let us know what you think, and subscribe to our page if you want more health information or other back care tips.